I'm Marge Gustowiak, and I'm a nurse and have been in the healthcare industry for over 25 years. I'm currently Vice President of Health Services. Today I'm going to talk to you about one of the most important skills that you can learn to become an exceptional healthcare worker. To me, this is the most important skill you can learn, so I hope you pay good attention. I'm going to give you a very few statistics to start with. We're talking about communication. Over half of our communication is done through our body language. So, do you lean forward and interested when you talk to someone, or are you kind of aloof? Be aware that your body language communicates 58% of your message. 38% is your tone of voice. Are you angry? Does your face show it? Does your tone of voice show it? Are you happy? I hope you have a good day. Are you sincere in your tone of voice? That makes up 38% of your communication. And the amazing thing to me is that only 7% is the words we use. So when you tell someone, I never said that, remember, 58% of what you communicated was your body language, 38% was your tone of voice, and only 7% were those words. So remember that next time you feel you've been misinterpreted. What we're going to go through today is three basic things. We're going to go through some basic guidelines in communication, then we're going to take a look at some special needs, and we're going to end up with barriers of communication. So let's get started with some basic guidelines. Your student handbook will list several. I'm just going to highlight a few for you. The very first thing you need to do every time is make sure you have the patient's attention. Knock on the door before you enter. Make sure you have eye contact. Make sure they know who you are and what you're there to do. Next, speak clearly and courteously. Find out what that person likes to be called. Do they want to be called Mrs. Smith, or do they want to be called Marge? Find out and use that name. And remember to always have good manners. Next, you should allow the time for the patient to talk and respond. When you communicate something, pause a little bit. Let them react. Then you know if they understood you accurately or not. Another important fact is never interrupt the patient. We're here to find out what that patient has to tell us. So if we start giving our opinions or fill in the end of the sentence for them, we're not going to be practicing good communication tips. Avoid showing that you're rushed or giving unhelpful responses. If you can't help them, let them know. But then give them an out. How can you help them? Perhaps you can get a family member involved, or talk to the manager and get that manager involved. But take your time and make sure that they can be reassured with your communication. Another basic guideline is to ask for clarification if you're unsure of what was said. You don't want to be on two separate topics. Perhaps a patient may not want a family member involved, but in your rush, you weren't real clear if they did or didn't. And so it would be a big mistake to get a family member involved if indeed they didn't want it. So make sure if you're not, that you ask the resident and be sure that you're clear on what they want. Do not be afraid to ask. Another one is to reflect on their feelings and thoughts by rewording the statement into a question. Oh, I feel so bad. And you can say, you feel bad. Tell me a little bit more about that. That's going to open it up, and they can tell you if I feel bad because I spilt my milk at breakfast, or I feel bad because I didn't sleep all night, or I feel bad because my daughter was in an accident. So if you reword that feeling into a question, it'll open up the topic. And another basic guideline would be to show interest and concern. And again, if we bring our body language into this, how are you today, Mrs. Smith? And then you're busy writing. She's not going to think you're concerned at all. Versus, oh, how are you today, Mrs. Smith? Give her a time to respond. And then show interest in what she has to say. This makes a tremendous difference. You show the interest, you show your care, because after all, that is what we're here for. Now let's look at some special needs. Remember, your basic guidelines will apply to all communication, but there are some special needs that some residents may have. The first one we're going to look at is the hearing impaired. Again, it's important to make sure you have that person's attention. Make sure they see you so that they know what communication is about to take place. There may be some devices that are available. We have hearing aids. The important thing to remember about those are that they're inserted properly, the battery isn't fresh, and that it's working. Be aware of outside noises like a radio because the hearing aid will amplify all noises. You may have a hearing amplifier, which is a simple device that makes your voice louder. So this may be available for you to use with a person with a hearing impairment. Or it can be as simple as a piece of paper and a pen, and you write a message for them to respond to. But it's another way to accommodate that hearing loss. Oftentimes, people will have a good ear. Find out if they hear a little better in one ear and make sure that's communicated so you can speak to that ear so there's a better chance that they hear you. Use short, simple sentences. If you ramble on and on, they're going to get lost in where you're going. So keep your sentences short and simple. Again, your facial expressions, gestures, and body language can help reinforce what you're trying to communicate. Are you thirsty? Would you like something to drink? Simple body language. Help them out. Remember, they can't hear. Also remember that sometimes people will be confused or appear confused and they're just not hearing you properly. So that's an important fact to remember also. Now we're going to take a look at that amplifying device I told you about. Andrew, come here.
What is it, Mrs.
I need
Smith?
to see my daughter. It's very important.
Mrs. Smith, can we put this on so you can hear me better?
I need to see my daughter. It's
Mrs.
very
Smith,
important.
Can you hear me okay?
Oh, I hear you very well.
Okay. What is it that you need to tell me?
I need to see my daughter. It's very important.
Oh, okay. You know your daughter comes in every day after work at 4 o'clock.
Isn't it 4?
No, ma'am. It's only 12 o'clock.
Oh, so she'll be here later.
Yes, ma'am. And I'll be here until 4 o'clock. And as soon as I see her, I'll send her right in, okay?
Oh, do you promise?
Yes.
Oh, good. Because it's important I see her today.
I understand, ma'am. Okay, I'll take this off now.
Thank you.
You're welcome.
Oh, he's so nice. I'm glad he's here today. The next special need I want us to take a look at is the visually impaired. It's important, again, to address by the name they prefer to go by, and you may touch them lightly so that they know that you're there and you don't startle them. Remember, they can't see, so now we're going to count on their hearing for our communication. Identify yourself and explain what you're there to do so they're not wondering, are they going to take my clothes off? Am I going to go for a walk? Do I have someone here to see me? You know, is my hair combed? So make sure you talk with them. Be very specific when giving directions. They don't have the luxury that we have of seeing what our room looks like, where the bathroom is. So be very specific when you give them directions. And always remember to have that call light within reach. If they need help, you don't want them getting up and stumbling in or going into a dangerous area. You want them to have that call light so they can summon for help. We're going to take a look at this being demonstrated in meal service. So watch this next one.
Mrs. Smith?
Yes?
Here's your lunch.
Okay.
If you need anything, let me know.
Oh dear. Oh, I made a mess already. Oh, how do I get a hold of him? Talk about doing everything wrong. Andrew couldn't have done a worse job at presenting a meal tray. And he wasn't being mean. He was just trying to get his job done. Now let's take a look at Andrew applying these principles and see what a difference it can make to Mrs. Smith's enjoyment of her meal this time. Watch. Yes?
Mrs. Smith?
Yes.
It's time for lunch.
Okay.
I have your tray right in front of you.
Okay.
Let me help you and show you where everything is, okay?
Okay.
Okay, right in front of you, you have your plate.
Okay.
At 12 o'clock, you have a baked potato.
All right.
At 3 o'clock, you have a chicken leg.
Okay.
At 9 o'clock, you have broccoli.
Okay.
At 1 o'clock, off the tray, you have some milk.